I'm Dr. Bill Lyle, and I practice obstetrics and gynecology, and I've delivered over 5,000 babies, and I'm the founder of a ministry called ProLifeDoc.org. And just when you thought we couldn't get more evil and demonic information regarding abortion, we need to discuss this article. This article was released last year in the Journal of Contraception. Contraception, how not to get pregnant. But this article gleans information and studies from 26 other articles from the United States, from UK, from India, from China and Australia on how the abortion pill can be used to kill a baby in the womb up to 28 weeks gestation. 28 weeks. Babies born at 28 weeks have a survival chance in the United States of 80 to 90%. Yet here are 26 different articles from all over the world giving protocols and policies on how these babies can be aborted while they are still on the inside of the womb, while they are still alive. But you know what? They also talk about how it's important to kill the baby in the womb before you abort and deliver the baby. Why? Because I'll quote from the article, for legal considerations as well as patient and provider comfort. Because the last thing you want is when you're trying to abort a baby up to 28 weeks gestation for the baby to come out and be breathing, have a heartbeat and moving its arms and legs and struggling to survive. So for patient and provider comfort, they recommend killing the baby before you start the abortion protocol. Well, how do you do that? You do that by inducing fetal asystole. Fetal, meaning the baby, the little one on the inside. Asystole, meaning stopping the baby's heart. And you think, well, how do you stop the baby's heart while it's still on the inside? Well, then you have to go to another article in Contraception. And here's that article right here. And this article will detail the procedures, the policies, and the dosing on how you can use digoxin and potassium chloride, place them in a syringe, guide the needle tip of the syringe through the skin of the mother, through the wall of the uterus, and then guide it directly into the heart of the baby, a heart which is beating on the inside. You inject the potassium chloride or the digoxin, and you essentially will kill the baby right there and then. And then you just need to deliver that baby. And that's when they will use the abortion pill and the contraction medication called Cytotec. Currently, abortion with the abortion pill is only indicated up to 10 weeks gestation here in the United States. But here are 26 different articles that give you the cookbook, the recipe, and the protocols to kill babies in the womb up to 28 weeks gestation all around the world. This is not an evil just in the United States. This is a worldwide evil. This is an attack on the image of God by Satan himself and his demonic forces. We need to stand up for God's preborn in the womb. We are created in the image of God at the moment of conception, and this is an attack on that image of God. It is not a choice. This is a spiritual evil. If you have any questions, you can get a hold of me, Dr. Bill Lyle, at my website, which is ProLifeDoc.org. God bless you all. Be bold. Stand up for God's preborn in the womb and do what is right. God bless you all.